Death, a topic nobody wants to speak about, a topic no one is comfortable with. However, what if you were given 6 months, no, 2 weeks to live, and were in untreatable pain? You could no longer use the bathroom by yourself, let alone feed yourself, but cognitively knew everything that was going on. This is where physician-assisted suicide comes to play. Legalization of physician-assisted suicide will help those suffering in a multitude of ways. We all aspire to fulfill the American dream of life, liberty, and the pursuit of happiness. If you or someone you loved were in a position where death were imminent, wouldn't you want them to be freed of their misery if that's what they wanted? I have witnessed many terminally ill individuals just wait for their final day while they and their families suffered. Physician-assisted suicides are a fundamental freedom to all. They allow terminally ill patients to die with their dignity, and they drastically reduce healthcare costs to all. In a world that is so quick to point out the facts of the Constitution, it has never been mentioned that the government has the right to keep patients from their death or suicide. Physician-assisted suicide is a fundamental right to all individuals. It is almost a violation of our rights and our religious freedom to not let a patient choose how they want to die, and they could resort to other options of death. So far, physician-assisted suicides are legal in 5 states with some restrictions. Typically, these restrictions are the certification of a doctor, usually being medical doctors, and the prognosis of the patient and how far they have along. Here's a quick timeline of the events that have taken so far in the physician-assisted suicide world. In 1997, the U.S. Supreme Court stated that it was not against the Constitution for a state to say or to ban the physician-assisted suicide, which left physician-assisted suicides up to the states. In 1997, along with that, Oregon passed the first Death with Dignity Act. In 2009, both Montana and Washington passed their Death with Dignity Act. And you can see in 2015, California was the latest to add to the list. According to the Oregon Health Authority, in 1997, again, Oregon passed the Death with Dignity Act. This allows terminally ill individuals in Oregon to end their lives through self-administration, which is important, self-administration of lethal medications prescribed by a physician for that specific purpose. According to Ira Byock, a professor at Dartmouth School of Medicine, he fears that it leaves room for a slippery slope. In Holland, physician-assisted suicide is legal, and 40 patients in 1 year sought out and received euthanasia due to mental illness and depression. This can be combated in the United States by rules and regulations that we implement. For instance, again, it has to be a medical doctor, and the prognosis of the patient has to meet a certain criteria. Physician-assisted suicide also gives alternative options for individuals in these situations. Just as physician-assisted suicides are fundamental freedom to all individuals, it allows them to pass with dignity while avoiding imminent deterioration. Terminally ill individuals often are left with very little hope and control. Allowing them the option of physician-assisted suicide will help them regain some sort of control and dignity in their situations. According to CNN, Brittany Maynard, who was 29 at the time, this is her, chose the option of physician-assisted suicide because she was diagnosed with terminal brain cancer. She stated, "I've had the medication for weeks. I am not suicidal. If I were, I would have consumed that medication long ago. I do not want to die, but I am dying, and I want to die on my own terms." Oftentimes, those who are dying are unable to physically take care of themselves as time passes. Nursing assistants are left to take care of their vomit, uncontrollable bowel movements, cleansing, meals, and the like. A physician-assisted suicide allows these individuals to take control of the last imprint they leave on the other individuals. They want to make a positive, lasting memory. According to the Disability Rights Education and Defense Fund, the fear of coercion, depression, Psychiatric disability and economic pressures could make individuals feel pressured to receive physician-assisted suicide. Again, this could be remedied by extensive therapy for a set period of time for the individual that wants physician-assisted suicide, meeting with psychiatrists and other doctors, and laws that require a specific diagnosis and criteria to meet a certain level. Not only do physician-assisted suicides grant individuals dignity and self-worth up until their death, they also ensure individuals will not be spending a fortune in healthcare costs. Physician-assisted suicides can reduce the healthcare costs for terminally ill patients. Oftentimes, terminally ill patients require hospice care and extreme amounts of medication and medical assistance up till their final day. The costs of care typically only accumulate throughout time. Many patients are typically already in debt due to the numerous amounts of treatments and medication and medical care that they have received trying to save their lives. According to the National Center of Biotechnology, in 2009, Medicare paid $55 billion for doctor and hospital bills. This alone was for the patient's last 2 months of life. That is crazy because although Medicare covers it, it also is out of our taxes, which is a lot of money, and $55 billion. In comparison, total spending for Medicare besides hospice in 2010 was $13 billion. This allows physician-assisted suicides allow individuals to leave some sort of financial assistance for the family they are leaving behind. Physician-assisted suicide is more beneficial than ever imaginable. It gives individuals an option even when death is upon them. Although allowing someone to choose their own death often seems taboo or immoral, it has enormous benefits for the terminally ill individual. We have always had the statement, put them out of their misery when it comes to animals. Why should it be any different when it comes to human beings?